This is Mountain Health Today. I'm Ted Owens, your host. This is a program brought to you by the Tahoe Forest Health System. And today I'm speaking with Harry Weiss, President and CEO of the Tahoe Forest Health System. Harry, very good to have you with us today.
Happy to spend time with you.
Harry, we're going to talk about something very, very important, and that is behavioral health services. Mental health is a very important thing all across the country, and you've been developing a rather robust program. Why don't you give us an overview?
Yes, I'm happy to do that. This has been a long-standing need in our community, and about 3 years ago, we had no healthcare professionals ourselves in this area of mental health, and we're happy to share with our community that in the last 3 years or so, our mental health team has grown phenomenally to around 18 or 19 individuals.
Harry, I'm going to stop you right there. 18 or 19 individuals in the space of mental health, and you're a critical access hospital. That's highly unusual, isn't it?
It is. Almost no critical access hospitals today have mental health programs. That's just not even within the reach of what they can commonly think to do.
And so what type of specialists do you have on board?
We've been able to assemble a great team. We have psychiatrists, we have very skilled psychiatric nurse practitioners, clinical psychologists, licensed clinical social workers, marriage and family therapists, and then we also have bilingual community health advocates.
Tell us a little bit more about the team. You've got 18, I believe, is on the team.
That is correct, and I think it's going to be approaching 19 or 20 very shortly. And this team historically has been focusing just during our short 3 years of having a mental health program on adults 18 and older. And I'll share a little teaser comment. Please watch for important news from Tahoe Forest Health System because we're adding some children mental health specialists in the not too distant future. So watch for more information on that as well.
Will do. That's quite a commitment to serving the public. What type of services do you offer?
In the psychiatric mental health area, we really offer diagnostic evaluations, important medication management for each patient, and individual therapy or group therapy programs for them. And so this really could be individual or group therapy, whatever is evidence-based to help them recover and maintain a good mental health status.
And you have a medication-assisted treatment program, a MAT program. What is a MAT program?
This also is very rare in a critical access area, and especially in rural areas. What medication-assisted treatment is this is a very evidence and skilled professional team who has developed a program that really helps our patients who might have an opioid addiction challenge in their life. And to put that in perspective, over any 2-year period, about 1/3 of the US population might have received a prescription for an opioid type of medication. And about roughly 500,000 people in America might struggle with addiction, about 16 million around the world. So having in a rural area a medication-assisted treatment program to help people recover is super important. What it does is it really helps to combat the cravings for opioid medication, and it really stops the actual need to use that opioid drug.
Harry, I understand. Two questions. Number one, I'm kind of curious about the success rate of the MAT program in stopping the use of opioids, but also, does this program address the rather severe withdrawals that a patient might go through as they are stepping down off of use of opioids?
It the medications that our team use do significantly ease the cravings and remove a lot of the withdrawal symptoms that a patient might feel. None of these programs are 100% successful, but if they follow our team's guidance, the success rate is very encouraging.
And also, does a MAT program directly address, the underlying issues that a patient might have for using or misusing opioids?
It also really does look at those issues. For example, are there aspects of their life that might have contributed to it in the first place? And so, yes, those tendencies or environmental issues that might have drawn them into it and made them more susceptible, they are looked at as well.
Harry, we have about a minute left. I want to talk a little bit more about the MAT program and how does a patient get into your MAT program? Are they referred, or are there other ways of entry?
If they can simply speak to any of our medical staff members, and in discussion with our medical staff will then refer any patient to we have several medication-assisted treatment certified physicians or providers, and they'll be referred to that person for ongoing care.
Okay, and we'll give some information about where the contact information is. This is Mountain Health Today. We're talking about behavioral and mental health with Harry Weiss of the Tahoe Forest Health System, and we'll be right back. And welcome back to Mountain Health Today. I'm Ted Owens, your host, and we're talking with Harry Weiss, President and CEO of the Tahoe Forest Health System, about a very important service line, and that is behavioral health services. Harry, historically, behavioral health services have been rare, if not non-existent, in the Lake Tahoe, Truckee region. It's a very important program, and you shared in the first segment that you're building a very robust and unique program to address these issues. And one question I have is, do you take all comers for these programs? Are there any limitations?
Great question. We're really happy to share in our program that we've developed over the last 3 years, with now a total of about 19 team members, that our comprehensive mental health program, and again, we're going to have children mental health programs coming very soon as well, so watch for news on that. But we offer services to the uninsured, to Medicaid or Medi-Cal, Medicare, and to commercial insurance. So this is vitally important for all of these patients, that we've created this level of access. And I think, just to give a little bit of an example of the size, we're doing more than 2,000 mental health visits a year presently.
That is quite an indication of the need that's probably existed for quite some time. Is this unusual for a critical access hospital to do? And are your nearby colleagues, other systems, do they offer these types of services like you do?
I'm personally not aware of any critical access hospital that offers mental health comprehensive services like this. And I'm also not aware that any of our other area hospitals, rural hospitals, are offering it as well.
So Harry, I understand in screening mental health care needs, you have access to all kinds of other programs that you've designed to support the community. Can you share with us a few of those programs and what they're about?
what we've done is we try to really connect the dots between physical health and mental health for our patients here. Is we have a thoughtful evidence-based screening program for every patient. When we go see our provider, I'm asked these questions as I go see a provider, just as any other patient would. And it's done very kindly, and it's really meant to scientifically, there could be various levels of depression screening, and so we go through that very thoughtfully, and so that if there is a condition that needs treatment, we can connect that to one of our appropriate team members. And this is about really preserving and improving health, saving lives. And so all of our primary care clinics offer depression screening of every clinic visit that goes on. I'm really grateful that they do that.
And Harry, I understand, and I think this may be a national issue, but during the pandemic and remote learning and what have you had impacts on our youth. And you have a teen program. Can you share with us a little bit about that focus?
Yes, I think a lot of us have seen, mental health risks, but we have a stress reduction program for teens, and this is only a small portion of it, but it really includes breathing, movement, visualization, stress reduction. These are all things that we work with our schools on, school health, physical education, and other techniques to really decrease stress in students. They have gone through a lot. This learning away from the classroom has been super stressful for them. And as we have these stress reduction programs and these confidence building and relaxation programs, it really reduces something that might cause otherwise a tendency to go after drug or alcohol use, or just something else that might decrease their mental health. So it really helps avoid drug, alcohol use, and it really improves the mental health of our children.
Now you also have a focus stress relief program for seniors, and what does that look like? How's it different?
Absolutely. A lot of times people think that seniors' mental health is always great, but when you actually look at data, there's a moderate percentage of seniors in every community that really struggle with depression or mental health issues. And so we have programs via our Wellness Neighborhood that really support and they equip our seniors on how can they mitigate, reduce their stress, improve mood, find joy in their life, find gratitude, remove or reduce those negative emotions that might be building up, and just have balance and mobility and take on a more positive view of life.
And Harry, we have about a minute left, but I don't want to lose this. Suicide is of great concern with the communities that you serve. Do you address that?
Yes, even going back to 2013, way before we had a mental health team, we really developed an interest and action in suicide prevention via a strong coalition in our region. And this program, working with many other partners in our community, has avoided or reduced suicide by individuals of all ages in our community in a material way.
Thank you. For the folks at home, you're watching Mountain Health Today, brought to you by the Tahoe Forest Health System. Today we've been discussing behavioral health services of the Tahoe Forest Health System with Harry Weiss. And we're going to take a break, and we'll be right back. And we're back with Mountain Health Today. I'm Ted Owens, and today we're talking with Harry Weiss, President and CEO of the Tahoe Forest Health System. And Harry, we're very, very important issue is behavioral health services, and you've built quite a program that is offering things that have never been offered before in the North Lake Tahoe region that I know of. You have a program called ACEs Aware, and I don't know anything about what that program is. Would you share with me and the folks at home the ACEs Aware program?
Right. This doesn't refer to a ball team to the east of us, but this is a very important national mental health topic, and adverse childhood experiences, which is where the acronym ACE comes from, has been shown and really developed in the mental health science to be a topic that healthcare professionals and moms and dads need to be aware of, and adults, should we have experienced adverse childhood experiences, we need to know about and respect. And so our mental health team is able to gently engage in that conversation to see whether is that a contributing factor to one of our patients having a mental health challenge. And so we have a specific program that helps them understand that, how to go through that process, how to come out on the other side of that challenge and begin to live a more victorious, positive life.
Harry, if someone's watching today and believes they may need some assistance in these programs, what's the first step that they should take on this journey?
I would first please be willing to speak to one of our medical staff members, or hopefully one of your family members would be willing to do that, and go and visit with that family member, and then let's get you connected to in our medical staff to one of our mental health professionals so that we can help you begin to experience joy and recovery to a quality of life maybe you didn't think possible.
And, you know, we only have limited time here to talk about behavioral health. We could do it all day, I'm quite sure. Where would you recommend someone go that wants to learn more about the behavioral health services at Tahoe Forest Health System?
They can go to tfhd.com /behavioral health services, or they can call 530-582-6205 and ask to connect as well.
Well, Harry, we'd be remiss if we didn't talk about, in addition to your commitment to the services, there are some physical improvements on your campus, and I know that you have something you'd like to share with the community about that.
Yes, we're extremely thrilled that we're the beneficiary of a $2 million grant to help us improve behavioral health infrastructure. This would be the facilities so that we have increased space to provide mental health services. And so we were able to really share the tremendous gaps that are existing in our community. And we received a very special award from the Department of Healthcare Services called, and it's a grant entitled the Behavioral Health Continuum Infrastructure Program Grant.
And my understanding is that that grant, in part, was awarded because of your commitment to the program and your financial commitment. You were already committed to developing appropriate spaces for the direct services of behavioral health, correct?
That is correct. They saw our track record of how we're trying to meet a tremendous community need that's much larger than our capacity, and they also saw our willingness to co-invest in mental health services, and that contributed to us receiving this $2 million grant.
And that's not an easy grant to get,
expensive.
Is it? I mean, how rare is that grant? How many recipients are there, for example?
There were a total of 46 recipients in the entire state, and that's in the context of maybe 350 to 400 providers in the state.
And this was a grant program, I believe, created by the legislature
That is
in
correct.
California. Okay, and so when is this space and infrastructure that you're developing going to be open, occupied?
We're excited to share that hopefully by the end of November, we've completed the construction. So November of 2022, then we go through a state healthcare accreditation visit. And so we're hopeful certainly in November or December of 2022, our expanded space first phase will become available to our patients. And then we have additional space that may be available in just a few months after that.
Harry, we have a little less than a minute left, but you know, a lot of mental health and behavioral health services are provided by counties. Do you believe that you'll seek coalitions with, say, our associated counties and the services they provide to even further enhance the programs?
Yes, it's really vital that we have an active partnership with our counties to make sure that we have the outpatient and inpatient services, some that might need to be referred to other areas.
Wonderful. This has been Mountain Health Today. I'm Ted Owens, your host, talking with Harry Weiss, President and CEO of the Tahoe Forest Health System. Harry, congratulations on a very robust behavioral health program. Very, very beneficial to the community. To the folks at home, thank you very much for tuning in. We'll see you next time.